You know, a medical diagnosis isn't always a straightforward, cut and dry process. Sometimes it's a full-blown detective story. The body leaves this trail of clues. Some are super obvious, others are incredibly subtle. And it's the doctor's job to piece it all together to solve the mystery. Today, we're going to open up two very different case files to see exactly how that works in action. So that's the big question, right? How exactly do doctors follow the evidence when the crime scene is, well, the entire complex, interconnected system of human biology? Let's dive right into our first case file and find out. Okay, so our first mystery is all about a silent signal. A clue that just appeared. No warning, no symptoms, which, makes it even more of a head-scratcher.
So, meet our patient. She's a 36-year-old woman, and she feels perfectly fine, totally healthy. But a routine blood test pops up with something kind of weird. Her calcium levels are consistently high. She has zero symptoms. But there's a really key piece of family history. Her mother had a similar issue. And that is our very first lead. And here's the real puzzle. High calcium can cause all sorts of nasty problems. We're talking kidney stones, bone pain, you name it. Yet she feels absolutely nothing. So what's really going on behind the scenes? It's time to dig a little deeper and gather more evidence. All right, to crack this case, we've got to look at the forensics. And in medicine, that means the lab results. This is where the story really starts to take a sharp turn. Okay, let's break down this evidence. First up, her blood calcium is high, just like we thought. Second, her parathyroid hormone, or PTH, that's the hormone that basically tells your body to raise calcium levels, is normal. Maybe a little high, but nowhere near high enough to explain that calcium level. But look at this third line. This is the clincher. Her urinary calcium is low. Normally, when your blood calcium is high, your kidneys go into overdrive to dump the excess into your urine. Her body is doing the exact opposite. It's holding on to calcium for dear life. Now that is a super specific clue. And all of that leads us right here to this one little number, 0.007. This is her calcium to creatinine clearance ratio. It's basically a score that tells us how good her kidneys are at getting rid of extra calcium. It might just look like a tiny decimal, but in this investigation, this number is the smoking gun. No question about it. It tells us exactly which suspect to focus on. Okay, so in the world of high calcium, there's a usual suspect called primary hyperparathyroidism. With that condition, the body tries to dump all that extra calcium, so the ratio is greater than 0.01. But our patient's ratio, it's less than 0.01. Bam. That one data point pretty much rules out the common culprit and points a giant flashing arrow at something much, much rarer, FHH. So what on earth is FHH? Well, the good news is it's a totally harmless genetic thing. The best way to think about it is like this. Your body has a thermostat for calcium, right? In FHH, that thermostat is just broken. It's set permanently too high. The body looks at its high calcium level and thinks, yep, this is normal, so it never even tries to fix it. It's just a glitch in the system. And just like that, case closed. A simple genetic test confirms the diagnosis of FHH. And here's why this is so important. By getting the diagnosis right, the doctors literally saved her from a totally unnecessary and pointless surgery to remove her parathyroid glands, which would have been the right treatment for the wrong condition. So that first case was all about deciphering a silent clue, but now let's open up case file number 2. And believe me, the situation could not be more different. The clues here are anything but silent. This is a visible emergency, a real crisis. All right, so our second patient is a 29-year-old woman, and she is really struggling. We're talking severe fatigue, weight loss, dizziness, and she's even noticed her skin is getting darker. Now, check out her history. She already has one autoimmune condition, and her sister has another one. Ding, ding, ding. For a medical detective, that's a huge clue. You're immediately thinking, is there a pattern here? And then she offers up this incredible piece of testimony, a constant, really intense craving for salt. Look, this isn't just some weird food craving. In medicine, something this specific is like a direct message from the body screaming that a key hormone responsible for salt balance is just gone. The physical exam turns up even more hard evidence. Her blood pressure is dangerously low, and it absolutely tanks when she stands up, which totally explains the dizziness.
And that skin darkening she mentioned, it's confirmed on her palms, knuckles, even inside her mouth. This combination, it's a classic textbook signature of adrenal gland failure. Okay, so let's recap the evidence. We've got the salt craving, the crazy low blood pressure, the skin darkening, and that family history. They all feel kind of separate, right? The job now is to connect them, to find that one single explanation that ties it all together. And the lab report? Whoa, it is conclusive. Her sodium is low, her potassium is high. Check, mineral imbalance confirmed. But the real smoking guns are right down here at the bottom. Her cortisol, the body's main stress hormone, is critically low. At the same time, ACTH, the hormone that's supposed to tell the adrenals to work, is off the charts high. It's like the pituitary gland is shouting at the top of its lungs, but the adrenal glands just aren't listening. This combo is a slam dunk diagnosis for Addison's disease. But wait a minute. A good detective never stops at the first answer, right? We know it's Addison's. We also know she has that autoimmune thyroid condition. Is that just a coincidence? Or are these two different crimes being committed by the very same villain? This is where we get to the big reveal, a condition called Autoimmune Polyglandular Syndrome Type 2. The analogy here is absolutely perfect. Imagine your body's security system just goes haywire and starts attacking the house it's supposed to protect. In her case, it attacked her thyroid gland a couple years ago, and now it's come back and attacked her adrenal glands. And there it is, the final verdict. It's not two separate problems at all. It's one single syndrome playing out in different ways. And by seeing that bigger picture, doctors can now be on the lookout for other related issues, like type 1 diabetes, which we already know runs in our family.
So, when you put these two stories side by side, one totally silent, the other an absolute emergency, what do they really teach us about the art of diagnosis?
Well, they show us there's a clear method, a playbook, really. Step 1, you have to listen to the patient's story. Their symptoms and family history are always the first clues. Step 2, you gather the hard evidence from physical exams and lab tests. And finally, step 3, and this is the most critical part, you have to step back and see the pattern that connects all the dots into one clear picture. So here's the bottom line, the crucial point of all this. A single weird blood test, that's just a clue. It's not the whole story. Real diagnosis, the kind that changes lives, is all about pattern recognition. It's about seeing the entire picture the body is trying to paint, not just a single brushstroke. And that really leaves us with one final thought to chew on. Both of these cases were cracked just by paying incredibly close attention to the body's signals. It really makes you wonder, doesn't it? What silent stories could our own bodies be trying to tell us right now?